Hello, Paul Kagabine with the Garland County Library, and I'm here once again with Judy Dare with the Garland County Master Gardener. She's the Know It to Grow It Committee chairperson. The latest episode in our monthly Know It to Grow It series, and it's all about everyone's favorite animal, the tick. Is that
It-
your favorite animal, Judy?
It's my favorite animal,
I'm
not to
sure.
find on my body. Yes.
So we have a very special guest tonight who Judy's going to tell you about in a minute. But first, there's a couple of special announcements.
Fun stuff.
We have some I'm going to tell them how they win the prize, and you're going to tell them what the prize is for. So you go first. What is the prize?
Well, tonight we're going to give away three $20 gift vouchers to the Garland County Master Gardener plant sale, which is this Saturday. So we've got a lot of great plants, and I'll tell you about the garden show in a minute during my introduction, but go out and spend that $20 and get yourself some fun plants. We've got all kinds of stuff from natives to annuals and just beautiful, beautiful things. So anyway, carry on, Paul, and I'll be back in a minute.
And you're giving away not one, not two, but three of those. Three. And you can pick those gift certificates up tomorrow morning at the library if you win tonight. And the way you win is just by asking a question. Any question?
Yeah, we're changing that up a little bit. We used to say comments and questions, but now it's just questions. So we're putting heat on y'all.
We've made it slightly harder. You can't just say hello. You have to ask a question about this month's topic, which is ticks and anything related to them and the illnesses they cause. So, Judy, I'm going to turn it over to you, and audience, please get those questions in, win some gift certificates to pick up tomorrow, and enjoy and learn a lot from the show.
Yes, everybody, thank you so much for joining Know It to Grow It. We really appreciate you being with us. Tonight's speaker is going to be very interesting, and he's going to present it in a new way, which I think is going to be really fun. But before we get to Dr. Shu, I'd like to talk about tonight's door prizes. As Paul says, we're changing up the format from the first three questions and comments to the first three questions. We're changing the door prizes up too, so every month there's going to be something a little bit different. So be sure to join us every month to see what you can win. Tonight we're going to give away three $20 vouchers to the Master Gardener plant sale. Now, the Master Gardener Garden Show will be held Friday, Saturday, and Sunday, but the plant sale will only be on Saturday from 9 to 5. The vouchers are good for $20 off Master Gardener plants, which are being housed in the horticulture building, which is number 6, from 9 to 5 on Saturday. So bring your voucher by then. All you have to do is take your voucher and your plants to the cashier, and you can pick up your vouchers tomorrow at the Garland County Library starting when they open. Now, the garden show is going to be bigger this year and better. It's going to open Friday afternoon at 12:30 and run until 5 o'clock. Saturday, the hours are 9 to 5, and Sunday from 12:30 to 5. There's going to be a lot of great vendors, and some of them will be selling plants and trees all throughout. So there'll be plenty to see all 3 days. We're also having some great speakers. Janet Carson will speak on Saturday. We've got people talking about camellias, butterflies, hummingbirds, just a plethora of speakers for you in the Arts and Craft building, which is number 5. But they'll give you a program when you get there. So come to the plant sale, spend your $20, and stay for the day. Now, May Know It to Grow It will feature a Garland County Library favorite, Belinda Jonak, who will tell us all about the snakes of Arkansas. Now, snakes and ticks are not my favorite critters, but it's always good to know what to watch out for and who are our friends. And Belinda is a super fun presenter. So on to tonight's presentation. Dr. Shu is an internal medicine doctor here in Hot Springs. He was born in Shanghai, China, and he and his parents immigrated to the States in the early 1900s, in the early 90s. I'm so sorry, y'all. Eventually settling in Hot Springs. He is a graduate of Arkansas School for Math and Sciences and went to UAMS, where he met his wife, Dr. Christine Lai. After working for a local hospital system for 10 years, he and Dr. Lai opened their own practice, which specializes in diagnosing and treating adult illnesses with a focus on geriatric medicine. Dr. Lai is also interested in women's health, while Dr. Shu enjoys infectious medicine. They have some weird interests, but all good. His hobbies include painting, basketball, and gardening. He has been to at least 8 Garland County Master Gardener plant sales. His favorite plant is hydrangea, and he just told us he has about 70 in his yard, with the peony being a close second. I am happy to introduce Dr. Shu.
Hi guys, how's it going? So today's topic is I think of interest to you guys because we all get it. We all get tick bites, and so I thought I'd talk about what to look for and how to take care of yourself and when to seek medical advice. Paul, if you'll pull up the slides, thanks. So tick-borne illnesses in Arkansas. Next. It's a fairly common disease, especially here in Arkansas. This is the prevalence in the U.S. And as you see over the years, this is the last from 2004 to 2019 CDC data, and it's been slowly but surely trending up. Next slide. So I thought I'd present the information to you guys in a way I felt like was interesting for me in medical school. This is more interesting because it kind of puts it into context, and then you're learning about somebody's story instead of just random facts that are blurted out to you. This is going to be a really common case that I see all the time, probably once a year, at least, if not several times a year here in Arkansas. This is Mrs. Smith. She's 75. She has a history of hypertension. She comes in August with fever and chills, which is kind of a tip-off because generally speaking, fever and chills and respiratory illnesses specifically happen, as you guys know, in the winter and fall months. She's an avid gardener. She's recently been bit by a tick. She's recently moved here from the Midwest, Chicago specifically, and she's unfamiliar with ticks. So on the advice from some friends and neighbors, she had tried to suffocate the tick by painting nail polish on it. So on exam today, when I saw her, she has a rash kind of all over. She has mild tenderness on the palpation of her abdomen. She's got a small tick on the left side on her left leg with nail polish over it. And then around the tick, there's some redness. Next slide, please. So this is one of the ticks that you can encounter. And you guys, I'm sure, have encountered lots and lots of different ticks here in Arkansas, unfortunately. This is the most notorious. As you see, the Lone Star tick, only the female has the Lone Star, if you will. And then in the larval stages, they still can and will bite you. So it's not as easily identifiable as just remembering that one star. I usually tell people if it's a tick, then there's unfortunately possibility of transmission of illness to you. So don't worry about what kind of ticks it is. Next slide, please. I thought this would be a good opportunity to talk about how to remove your ticks. And so definitely don't keep the tick on and try to suffocate it or burn it or anything like that. Get a pair of tweezers and get at the base of the tick and pull vertically perpendicular to your skin. Afterwards, clean the area with either soap and water or alcohol wipe. And then most importantly, I know you want to exact vengeance, but the best way to do it is just flushing it down the toilet. Lots of people get ill because they try to crush the tick, and then you get the germs that are inside the tick in your fingernails, and that can stay around with you for a little bit. And then if you wipe your eyes, that's a really easy way to get sick, especially as we'll talk about later. It's actually fairly hard for the tick to get you sick, but it's a really easy way to do it yourself if you if you try to crush the tick with your fingernails and then wipe your eyes later. Okay, next slide, please. So what does Mrs. Smith have? Well, here in Arkansas, here are some common diseases that are transmitted by a tick. Rocky Mountain spotted fever, famously Ehrlichia chaffensis, which is named after Fort Chaffee here in Arkansas. Tularemia, which is a really nasty one, and Starry, which is a constellation of symptoms, and that one is specifically caused by the Lone Star tick. For the purposes of people who are just trying to learn about tick-borne illnesses, who aren't physicians, the most important thing is to recognize that actually a lot of these, and really even for physicians, a lot of these illnesses present very, very similarly. So there's really not that important of a reason to figure out exactly which one you have. The most important thing is to seek medical attention if you're feeling ill. And so Starry is the only one on that list where actually treatment with antibiotics doesn't really help, but we don't actually know as much about it as we'd like. So we don't make that differentiation. We typically treat with doxycycline specifically because tick-borne illnesses can kill you. Now, there is a caveat. Like I said earlier, if you know that you were bitten by a tick and you know exactly how long it had been on, and if the answer is less than a day and you did all the right steps to remove it, then you don't actually have to have empiric antibiotics, especially if you're feeling well. And so of note, the American dog tick, which is, again, super common, that is a very common vector for a lot of these illnesses. So it doesn't have to be that Lone Star tick that is so notorious. Next slide, please. So Mrs. Smith comes back to the clinic, and she finished her antibiotics out. She's feeling better overall. She still has some nausea, and now it hurts to swallow. She also has a new rash. It's decidedly different from her previous rash because it's only on her hands and some on her face, basically the areas of her body that's exposed to the sun. She had been on an intermittent fasting diet, and she's still working in her garden. So she's still outside. We did decide to do blood work on her, and all the labs that came back to test for those tick-borne illnesses were negative. And that's another common point that I wanted to mention, is that unfortunately the labs for the tick-borne illnesses are not always very reliable. The timing, and depending on the type of labs that you're trying to get, it makes it kind of difficult to figure out exactly what you have. And we usually don't wait on the labs to treat you because you can get really sick. And so so there's two types of labs. There's PCR, which is a specific type of lab to try to figure out if you have active bacterium in you. And so, and that timing has to be when you're ill. And then there's antibody testing that we can do. And a lot of those testing don't actually come back as being positive when you're acutely ill. So like I said, the labs can be tricky, and depending on who your doctor is and what he ordered, it doesn't always come back positive, even if you were ill and if you were truly ill with that problem. So she comes in, and she still has that tenderness on her abdomen, but it's a little bit different. She says, "I don't feel good." And then on her hands, both sides of her hands, on the back of her hands, it's bright red. So it's definitely different from what she looked like previously. Next slide. So this is a good time to talk to you guys about not just the illnesses that you can encounter, but a lot of you guys will, especially if you go in to see your physician about a tick-borne illness, you'll get this medication, doxycycline. It's really the medication of choice for tick-borne illnesses because it covers almost all of them, and especially almost all of them here in Arkansas. So we really use this a lot when you come in for something like this in the summertime. But doxycycline has some potential pitfalls. So if you don't take it with food, and so for instance, if you'll recall, on Mrs. Smith, she had been on an intermittent fasting diet. So that means that she probably didn't take her medication with food. And so unfortunately, if you don't do that, it can cause some erosions in your esophagus. So we do definitely recommend that you at least get a full glass of water, but definitely get something to shove the pill down so it doesn't get stuck in your throat. And then the other unfortunate potential side effect of doxycycline is that if you're out in the sun while on the medication, it can cause photosensitivity and a rash. And so we strongly suggest that when you're on the medication to stay away from it. And that's why I wanted to kind of also go over in this case is that even though sometimes it seems like you're going in for a fairly simple issue, it can drag out into lots of other problems. And ideally, the physician that's taking care of you has all of those in the back of his head, and is trying to account for all of those when he's examining you and taking care of you and going through the steps of your care. Next slide, please. So Mrs. Smith, she comes back 3 months later for a regular checkup. She says she's feeling okay, but now things are a little bit different. Again, she has another rash, and this time it's different because it's itchy, whereas the other ones weren't really itchy, and it's only on her legs. So again, it's a different location, and it's kind of more raised, whereas the other two rashes are typically flat. And now she has diarrhea too, which is different from what she had before. So recently she switched her diet again to paleo, and so she's lost a lot of weight, and she had attributed the weight loss to the paleo diet. But then now she's thinking maybe it's something else because she's really having a difficult time maintaining her weight. The one plus about losing the weight is that her blood pressure is actually kind of low. And so she's only got the one medication that she took before, and it was 10 milligram lisinopril, which is a super common blood pressure drug. And so there's, again, a lot to unwrap here. It's just one paragraph, but for a physician that is careful, there's a lot to unwrap. And so if you'll go to the next slide, Paul. So she has what we call urticaria, or in common terms, she has hives. And it's just an allergic reaction to something. And so we can't always tell exactly what it is, and it can be variable. It can be really simple and self-limited and just a couple blotches, and it could go all the way to horrible swelling and anaphylaxis and death. And so she's taken off of her lisinopril because her blood pressure is pretty good anyway because of her weight loss, and she has an alpha-gal panel drawn in the clinic. And so she's advised at that time when we draw the alpha-gal panel to go ahead and stop all mammalian meat. So anything with 4 legs and fur to go ahead and stop. And so there's a couple reasons that we do this. Lisinopril, unfortunately, and all the ACE inhibitors, so enalapril, a lot of these medications in that class, unfortunately, can cause urticaria even years after you've been on the medication. So it's a little bit tricky. We didn't want to just treat one problem. We wanted to figure out which, if she had an alpha-gal issue or if she had a problem with the lisinopril. So we stopped the mammalian meat and we stopped the lisinopril. Next slide, please. So alpha-gal, unfortunately, can be a complication of a simple tick bite. And so she comes back to clinic 1 month later, and her rash is gone, and she finally feels like herself. Her alpha-gal panel was positive, and this happens, unfortunately, so much in Arkansas because we have so many ticks, and I see probably 2 or 3 new alpha-gal patients every single year. Her weight's coming back up because she's not having diarrhea all the time anymore. And though, unfortunately, when her weight's coming back up, her blood pressure is coming back up also. So just so that we don't complicate the picture, we started back on losartan, which is a sister drug of lisinopril, but it's way less likely to cause any urticaria or angioedema, any kind of that swelling and rash that she had before. She's also given an EpiPen with very specific instructions on how and when to use it. And a couple of points about alpha-gal that are interesting. Alpha-gal is actually an allergy to a sugar, a carbohydrate, which is kind of weird because when I was going through medical school, which wasn't that long ago, at that time, the common convention was that you actually can only be allergic to proteins, and that you're not really, people aren't really truly allergic to other stuff. There may be sensitivities and etc., but no true allergy came from carbohydrates or fats. And so, but then alpha-gal was discovered shortly after I finished medical school, and it's kind of a new thing. It's a carbohydrate that people are allergic to, and it's in mammalian meat. And so it's usually, we think, happens after tick bites, and it's difficult to diagnose because there's such a variation on different types of symptoms. You can have diarrhea, you can have the rash, you can have anaphylaxis, you can have just abdominal pain or nausea, and you can have any or all of those, and you can have very mild or very severe reactions. And so one of the key things for her, and is fairly common with alpha-gal, is that you get a rash in your legs instead of your whole body. A lot of times that will take check an alert for us, because typically when you have a reaction to a drug, for instance, lisinopril, it's usually on your body and not on your extremities. And the tricky thing about alpha-gal, unlike most of your allergic reactions, when you ingest mammalian meat and you have alpha-gal, it actually happens, the reaction that you get happens several hours later. So you aren't always able to connect the dots. Whereas a lot of times if you have for instance, a peanut allergy, you have something with a peanut, and then, boom, 15 minutes later, you're swelling, you're having trouble breathing. And so that gets you, alerts you much faster. Unfortunately, repeated tick bites can worsen or prolong that allergy. And then development of alpha-gal is unfortunately independent of treatment of tick-borne infection. I'm sorry, that was we're having some I'm having my alarm fixed right now. So anyway, like I said, alpha-gal can be independent. So you don't have to have a tick-borne infection to get alpha-gal, and it could be something that can happen on a tick bite that you may not even have noticed, because sometimes ticks can bite you and drop off. So you may not even have remembered the tick bite. Next slide, please. So this is another case presentation of something that's a little bit more rare, but it comes up a lot when you're discussing tick-borne illnesses, so I thought I'd add it in. So this is a 37-year-old man. He'd previously been healthy, and he comes in with fatigue and joint pain. He feels exhausted, but he blames this on a recent trip camping to Connecticut. He states that he does recall several tick bites. He's not sure how long they were on. And he had a rash on his back, but that actually wasn't where he was bitten by ticks, so he thought that was kind of weird. And he found it peculiar because it also wasn't itchy like his tick bites were. On exam, when I saw him, he had a swollen left knee that wasn't red. And when I listened to his heart, he had an irregular heartbeat. And the left side of his face was a little bit droopy. Next slide, please. So this is a picture, not a picture of the actual rash, but this is a CDC picture of what a bullseye rash looks like for Lyme's disease. Next slide. And that's what he has. So he has Lyme's disease. It is actually the most common tick-borne illness in the US, but the distribution is primarily in the northern states. In fact, I looked on the CDC website because it is a reportable disease. And for us here in Arkansas, I think we just had one case in the last 5 years or so. So it is a fairly rare disease here in Arkansas. It can cause long-term problems, which is a little bit different from the other tick-borne illnesses. And so typically the other tick-borne illnesses, if you get over them, you don't have typically long-term problems with it. The diagnosis for Lyme's disease, again, just like the other tick-borne illnesses, but especially with Lyme's disease, is really tricky because they're unreliable. And then on top of that, there's false positives and false negatives. So it can be really difficult to diagnose. That really outlines the importance of prevention of all of these diseases. And so ideally, you don't get any of these outside of the likes of the alpha-gal, which is something that you can't help, but even thus, and so ideally you don't get that tick bite. And then on top of that, obviously, if you do end up having a tick bite, removing it as soon as possible. And so there's a couple other diseases that are, again, typically northern states, anaplasmosis, and then a couple other ones possible that also present like this. And so luckily for us in Arkansas, like I said, they're not quite as common as those that Mrs. Smith, that we talked about in Mrs. Smith's case. But like I said, the symptoms that 37-year-old gentleman had were more peculiar and, like I said, more specific for Lyme. So the arthritis that he had, the irregular heartbeat, and then the neuropathy causing the droopy face, those are all, like I said, more akin and issues that can come up with Lyme's disease. Next slide, please. So again, that's part of the reason why it's a little bit less common. This is the most common vector for Lyme's disease. It's a black-legged tick, and the distribution of this, along with the reservoir, which is one of the rodents. And if I recall, the reason why we don't have as much Lyme disease here in the southern states is because how that happens when the tick bites the reservoir, one of those rodents, and how the seasons change, it just doesn't work out very well for us for that to be sustained here in the southern states. Next slide, please. So that's all the slides and most of the information. I thought, like I said, this would be an interesting way to present several of the common illnesses, how to prevent them in terms of tick-borne illnesses. Do you guys have any questions?
That was great. I am so glad that you have a interest in all these kind of infectious diseases, and I'm sure ticks aren't the only ones that you deal with. But so Lyme's disease is not very prevalent here in Arkansas, but obviously, how many cases do you see? Did you say 5 or 6 a year of the other cases?
Correct. So I see several cases a year of the other diseases. And like I said, what I usually do is I tell my patients, if you want to get, we can certainly send out the laboratory check to see exactly what type of tick-borne illness that you got, with a caveat. Like I said, the treatment is almost always the same. And on top of that, like I said, the lab work isn't always very reliable. So a lot of times, like I said, they choose not to do that because of the fact that, again, it wouldn't really change the outcome or the treatment for them. And so, but with that being said, treatment is still very important because we've had patients that have been hospitalized because of this. So it's not just, fever and nausea and feeling uncomfortable at home. There have been patients of mine that have had to go to the ICU because they were so sick with one of these tick-borne illnesses. Specifically, tularemia, I think, carries like a 5% chance of death. So it's not, it's not insignificant.
So you were talking about the drug interaction and what did, since a lot of the treatment is the same drug, what are those symptoms that are caused by the drugs and what should they not do, like sun and,
those are the big ones. Yeah. Like I said, doxycycline is our go-to drug for most tick-borne illnesses and most, illnesses related to bugs in general, actually. And so, but like I said, it does come with some fairly common side effects. The issue with the esophagitis, like I said, where she had, chest pain and abdominal pain because she had a pill that got stuck there for a little bit and that caused an ulcer in there. And so you definitely want to make sure that you drink at least plenty of water with the pill so that it goes down into your stomach, and your stomach is nice and thick. and it's built to handle stomach acid. So it can take care of itself, versus your throat and your esophagus is not. So it's not built to handle anything that's abrasive or erosive. So we definitely want patients to make sure they take the pill and get it down into the stomach. And then the other thing, like I said, that's very important is that it is fairly common and reliable for patients to get that photosensitivity where they get the rash and almost like a sunburn from being outside if they're on that drug.
So tell us where your clinic is, because I did not get to that.
Oh yeah, so we open up our clinic. My dad has a building downtown, and so I thought it would be a good opportunity to stay close. And we have our clinic is downtown, right across from Hilt-Wheatley Plaza, and it's on Exchange Street.
Excellent. Hey, Paul, do we have any questions?
Well, we have a couple so far, meaning we still need at least one more question because the next person will ask.
I'll ask a question if no one else does.
First question from Jill: why do many doctors shy away from Lyme testing?
So I don't know that they necessarily shy away. I mean, she may have had that experience, and so we're very willing to, or at least in my case, I'm very willing to offer that with a caveat that they understand. Like I talked about in the slide, it's not as reliable as we like. So there's lots of false positives and false negatives with Lyme testing. There is a Lyme PCR that I believe Mayo Clinic does, but it's a send out test, and so it's not really. I don't think it's very readily available here. And then on top of that, like I said, here in Arkansas, the rate of Lyme disease is really small because of the fact that we're really a little bit too far south to have, like I said, there's an issue with the reservoir to where it and the tick don't come out at the same time, if I remember right. And so that's why the ticks aren't carrying the Lyme disease at nearly the same rate as in the northern states. And so the reservoir that carries that disease and the ticks, like I said, they don't come out at around the same time. And it's just an issue with the timing and the weather. And that's why you'll see in the Midwestern and the Northeastern. And that's why, so there was a reason why I included the camping trip to Connecticut is because Lyme disease is named after a town in Connecticut called Lyme, Connecticut. So.
Let's see. Tina on YouTube says this is so interesting. Thanks for watching, Tina. And how does the meat reaction come about?
So it's a carbohydrate. We're still learning a lot about alpha-gal syndrome. And so we feel like it happens because the tick has to spit into you to prevent clotting, just like mosquitoes and a lot of these things. And we think maybe we're still trying to learn and see if other blood-sucking animals do this and transfer this. And so but the theory is that they ingest blood from other creatures, like say a pig or a cow or a rodent even. And so the tick does that first, and then when it ingests the blood from those animals, it keeps some of that around. And whenever it tries to bite, or whenever it bites a human, it has to spit into the human, and that exposes the human to those carbohydrates in the animal blood, and that unfortunately causes it. And so one curious thing about alpha-gal is that if I remember correctly, we don't have it. So it's not actually something that primates have. And so.
More questions from Jill. Does Rocky Mountain spotted fever have long-lasting symptoms? If so, is there anything to do to help years later? And is it common in Arkansas?
Rocky Mountain spotted fever is unfortunately pretty common in Arkansas. And so it is one of the more common, I would say probably half of my patients that have a tick-borne illness that we check them on end up coming back with Rocky Mountain spotted fever. We like to joke, I don't know if it's that good of a joke, but we used to call it Rocky Mountain spotless fever. And so because actually only about a third of the patients have the spots, and so most of the patients don't present with a rash. And so and there aren't very much long-term issues if you survive the initial onslaught pretty well, if you will. So for instance, if you went in to the hospital and got treated, or if you went into the clinic, ideally you went into the clinic and you got treated and in time and you did well with that, generally people recover back to their baseline and it's not a big deal. I've had a couple of isolated cases where patients weren't diagnosed and ended up really sick, and they may have some long-term illness just from the fact that they were so sick. But it's not quite like Lyme's disease so that gentleman that's 37 and had the Lyme's disease, that neuropathy is probably never going away, and that heart condition is probably never going away. So it's a little bit different in that case, that we really kind of put Lyme's in its own category. And Lyme's disease, we actually put it's a little bit different also in that we say it's Lyme's disease, but there's actually a couple different bacteria that can do that. So specifically, if you get really technical, there's actually a couple species of bacteria. But back to Rocky Mountain spotted fever, like I said, it is, like I said, luckily not much in terms of long-term problems from it. If you start feeling ill and you go into the clinic, you can get treated right away. Typically, patients do really well and they recover fully.
Well, I have a question for you. How should we stop getting ticks on us at all? I mean,
yeah. So ideally, you try to keep the yard, and I'm sure for gardeners they do that anyway. They try to keep the yard pristine in terms of getting things. The tall weeds is where they like to be, and so definitely spraying yourself down with a pest repellent before you go out. Wearing long sleeves and long pants. I've had some patients that have said that they have done. What they've done is they put tape, reverse tape on their ankles so that when the ticks crawl up, they get stuck on the tape, and they said they've had good success with that. So any and all of those things, because like I said, with regards to the alpha-gal syndrome, it doesn't matter if you get a tick-borne illness in terms of an infection. It doesn't have to have an infection. You can get alpha-gal syndrome, and there's not, as far as we know, there's not a time limit like there is with the tick-borne illnesses. The ticks have to be the infectious ones. The ticks have to be on you for at least a day. But with the alpha-gal, we're not sure because we're still learning so much about that syndrome. And so it is the best way to take care of that is prevention.
So ticks. I've always, worn a hat and all that, but ticks actually crawl up from the ground. So
yeah, ticks usually crawl up. Usually what'll happen is you'll get one either on your shoe or on your pants from a blade of grass that it was sitting on, and so
I've been paranoid from all different directions, so that's good to know.
I'm gonna do one more call for questions, so we have some winners for these vouchers for the plant sale this weekend. There is a similar question on YouTube to Judy's from Sheila. What plants will keep ticks away?
That's one that may be better with some of these master gardeners. I'm not sure, and so I'm not sure in terms of what plants that will be helpful. I do know that obviously citronella is useful for mosquitoes, if I understand right. But as far as ticks, I just don't know.
I don't either, but I'll try to do a little research.
Regine says, I like using a lint roller to collect any ticks before getting in my vehicle after going on a woods hike.
Oh, good idea. Yeah.
Very good. That should, if there's not a third question, that should.
Well, Sheila's was the third.
Deal.
Regine says repeated prescribed burning is effective for reducing tick numbers on a landscape.
Oh, cool.
Is Regine our friend from the U.S. Forest Service?
Yes.
Very good.
Speaking of which,
you should definitely be a resource for that. Yeah.
Yeah.
we're having free tree Friday seedling giveaway at the library this Friday. That is while supplies last, starting at 10 a.m. advertised till 1 p.m. But I don't think it'll last that long. The last one did not, but they're giving away hundreds of saplings, first come, first serve. You can check our recent Facebook post for more info.
It's awesome. I think you've done 2 tree things and they've not lasted very long.
Well, this will be the second one this year, and we try and do at least one annually. And yeah, they're a huge hit. So thank you to Regina and everyone over at the Forestry Department. Regina says Arkansas Department of Agriculture Forestry Division will be there Friday. Looking forward to it. Looking forward to hosting you.
Awesome. Well, I've really enjoyed and learned a whole lot, and I really like the fact that you presented in a kind of a case history, because that's something that we've never done on Know It to Grow It before. But that's how things progress. So, we all need to be very cognizant about how that happens. And so I thank you very much, and look forward to seeing you this weekend.
Yeah, I'll be there.
Yeah, and everybody just remember to come out and see us. It should be a fun time. We've, like I said, lots of different speakers, lots of different plants, and we just would be happy to see you all there, and happy to have you here tonight. And thank you.
Absolutely.
Thanks for having me.
Yes, our 3 winners for the vouchers are going to be Jill, Tina, and Sheila, and you can pick those up at the library tomorrow. Find them one more time, Judy, on the plan for this weekend.
Okay, so Friday we start the plant sale at 12:30. It runs to 5. On Saturday, that's when the Master Gardener plants will be in the horticulture building. That will be from 9 a.m. to 5. And on Sunday, we open the garden show again from 12:30 to 5. So when it's not the plant sale hours, there will be plants there. There will be all kinds of vendors there. There will be all kinds of products there. I mean, from worm casings to hostas to, laser cut shovels. I mean, some of the stuff that you will see there, just beautiful pieces of art. So the garden show goes all 3 days, but the plant sale for the Garland County Master Gardeners is on Saturday only from 9 to 5. And we'd love to see you there.
And our next Know It to Grow It episode is next month, always the 3rd Wednesday of the month, which next month is May 18th.
And Belinda will be joining us, and who knows? I'm going to call her and see if she's going to bring a snake. I'm not sure. We're having 2 kind of creepy things in a row, but we all need to know about these things.
And Dr. Zhu, thank you for your time. You were super thorough and interesting. And a quick question from Jill about the sale. What is the location?
Oh, I'm sorry. It's at the Garland County Fairgrounds. It's out Malvern Avenue. It's a little bit far out, not quite to Magnet Cove. So just go out Malvern 270 and look to your left. Should be there very shortly. And also, I would like to thank one of our friends together, Dr. Shu, Rita Monson, for getting me together with you.
Thank you.
Yeah, she's wonderful, and she thinks a lot of you. So
thanks. She is wonderful.
She is. I'm on her a lot of committees with her, and I think she's awesome. So if anyone wants to be a master gardener, come and talk to us at the plant sale. We'd love to have you.
Dr. Zhu, any final remarks or advice from you?
No, just like I said, be safe. It's the prevention is the biggest deal, because you hate to already be ill, and then like I said, some of it we can't even treat afterwards. So it's definitely good. I know it's super easy to say, oh, I'm just gonna go out there, but it takes just like 10 seconds to spray yourself down at least before you go out. So.
All right, and one more reminder to the audience: where can they find you?
Oh, I'm at Exchange Street here in Hot Springs, Arkansas, downtown.
Excellent. All right. Well, thank you both, and thank you everyone for tuning in.
One.
Thanks.